walked into the OB unit to visit my grandma at work. When I stepped off the elevator, I saw a nurse plop down in her chair and she looked emotionally exhausted. When I asked her what was wrong, she said, "Drugs. That's what's wrong." And I knew exactly what she was talking about when I walked past the nursery glass window and saw an infant shaking and wailing uncontrollably, with little tears running down his face. My grandma soon filled me in on the little boy's situation. He was an orphan, abandoned by his mother for the simple fact that drugs were more important to her than her infant she had just given life to. She abandoned that baby to lay in a hospital alone to suffer through the withdrawals while she was out on the street getting high. Women who test positive for drugs during pregnancy should not have the opportunity to continue to reproduce as long as they test positive for substance abuse. Neonatal abstinence syndrome is a major issue that's taking place in our country right now, and the numbers are continuing to rise at an alarming rate. Many people believe that drug addicts are capable of functioning like normal human beings, that they're able to make logical and appropriate reproductive decisions. These same people come up with illogical beliefs about neonatal abstinence syndrome and about the rights of these women who abuse drugs while pregnant. When a pregnant woman comes into the hospital, they don't want to be monitored or babied or lectured about their life choices. They're people just like you and I, and they're capable of taking care of themselves as well as their infants. They should not get their child taken away for the simple fact that they made one poor decision to do drugs. That's what some people believe. People also believe that neonatal abstinence syndrome is not detrimental to the infant. They believe that the withdrawals are just temporary and that the infant will eventually function and be as successful as an infant born as drug-free. These women who come in and have infants when they are addicted to drugs should not have the ability to take care of the infant after they have birthed the child. Doctors should also have the ability to tie the women's tubes as soon as the infant is born. This is because the women can't even take care of themselves, let alone an infant. They are literally pumping poison into their veins with each injection of heroin or line of cocaine that they snort. This poison, it has an effect on the infant, a long-term effect of stunted growth, language, achievement, and a predisposition for that infant to eventually abuse drugs themselves. So the cycle is continuing on no matter what after the infant is born. These infants aren't given the same rights and abilities as infants that are born with a drug-free parent. So the next point of my topic is I believe that the simple fact that a woman tests positive for drugs is enough to make the woman not leave the hospital with the infant. However, this doesn't always occur or doesn't always happen like this. So CPS is so full of orphaned infants that they don't have anywhere to put these babies. So they opt to give the infant to another family member, say a grandma or an aunt. And the simple fact is that as soon as they leave the hospital, 9 times out of 10, the grandma or the aunt just passes the baby back to the mom. And CPS doesn't check up to make sure that infant is safe. That's why you hear about all these child abuse charges on the news. It's because CPS doesn't do their job. That little boy I told you about at the beginning of my speech, his grandma came back for him after 2 months. 2 months he laid in that hospital bed and went through withdrawals without one call from a family member, without one visit from a family member, or show or sign of concern from a family member. And CPS allowed them to take that infant from the hospital without any kind of question. That little boy, he welcomed a little sister to the world a year later. And that little girl had the same beginning he did because nobody stopped their mother from having her. The mother was a heroin addict and had ran out of veins to shoot up in. So she became pregnant again so the veins in her stomach would stick out and she could inject the heroin into the stomach. That little boy and girl will go cold on days like this because their mom can't afford to buy them a coat. That little boy and girl will go hungry most nights because their mom is a drug addict and can't afford to buy them food. That little boy and girl will more than likely become another number in the statistics of child abuse. Statistics show from DrugRehab.us that 2/3 of kids that grow up in drug-addicted homes become drug addicts themselves. So Is that little boy and girl going to become the 66% that become drug addicts again? When is this cycle going to stop? Thank you.
You said like it'll keep on occurring down the line.
Yes.
Do you think that abortion is an answer for that?
No, personally I do not, because I don't agree with abortion at all. And if these women have the infant and there are ways to rehabilitate the infant and they can be placed in a better home, I believe that that is a better option. And most of the time when these women come in, they're already so far along that the damage has been done. Yeah.
I don't know if there are there supposed to be like consequences if CPS were to check up on the families that like it gets passed to the grandma and then she just gives it back to the mom? Should the grandma suffer consequences? If so, what?
I believe they should, but in this case, CPS didn't do anything about it because the mom came in a year later and had another infant, and they were aware that the little boy was living with his mom at the time, and they just have so many kids in there that they don't have anything else to do with them, so they don't do their job. Yeah.
So you said that babies being born into drugs or drugs, are they doing anything about it?
I know like in Cincinnati at Children's Hospital and at Methodist, they are actually creating these programs, the perinatal addiction treatment programs that I talked about in my last speech. So they rehabilitate the mother and they try to wean the mother off of the drugs while she is pregnant, because then the NAS is less severe when the infant is born. Morgan.
How much would it cost for one to get her tubes untied after like they're clean of drugs?
I'm not sure. I didn't look into that, but they can have their tubes untied because I know a lot of people are anxious about letting the doctor do the jobs of tying the tubes, because then what happens if the woman becomes clean and she wants to have a baby? They can untie the tubes, but I'm not sure about the price. Sorry.
If a child is born with NAS, could the mother be charged with any form of child endangerment?
I know in Tennessee they do. As soon as the infant is born, the mother is taken to jail, and she does have charges, but I know a lot of states, they don't make consequences because then they're afraid that the women won't come in to seek any kind of help. Logan.
Do you think that the NAS is worse or not as bad depending on the drug use?
It is worse depending on the drug use. I know alcohol is really bad, and you see more of the long-term effects, the cognitive and motor delays with alcohol, and opioids and heroin. You don't see as much with like cocaine. I'm not really sure why, but I know alcohol, you see it worse than any other kind of